Welcome back all of you to Mock Test Explanation Series, Part 26 for Government Nursing Officer exams like RRB, ESIC, AIMS, etc. The first question, prior to administration of albuterol nebulizer, the nurse should help the patient to assume what position? First option, sitting and leaning forward. Second option, feet elevated. Third option is high fowlers. And fourth option is standing position. Let us see the right answer now. The right answer is option 3, high fowler's position. Nebulization should be given in an upright or semi-upright position greater than 45 degrees angle. This position facilitates maximum lung capacity and improves the medication distribution. Another important thing is when a patient is having chest physiotherapy and nebulization, nurse should ideally perform the chest physiotherapy after the nebulization because nebulization helps to open airway and loosen the secretions, so making the chest physiotherapy more effective. These are two important points or important questions that can be asked regarding nebulization. Next question. Vaccines that can be freeze and still it does not lose its potency is option 1 MMR, option 2 DPT, option 3 TT, and option 4 is OPV. Let us see the right answer. The right answer is option 1 MMR. Freeze-dried vaccines like measles, mumps, and rubella, that is MMR. Some live vaccines like varicella, zoster, and smallpox also tolerate freezing temperature. So, MMR, varicella, zoster, and smallpox vaccines can be frozen without losing its potency. Freeze-dried vaccines like MMR can be frozen without losing their potency because these vaccines are manufactured in a dry form and are designed to be stable under frozen condition, making them suitable for long-term storage in freezer. Some other important point regarding vaccination. The most heat-resistant vaccines are diphtheria, TT, and HPV vaccines. Oral polio vaccine or OPV is most heat-sensitive vaccine. BCG, measles, MR, and Japanese encephalitis vaccines also heat-sensitive vaccines. Next question. The surgical removal of the entire content of the orbit including the eyeballs and eyelids is option 1 orbital evisceration, option 2 orbital enucleation, option 3 orbital extenteration, and option 4 is orbital laser surgery. Let us see the right answer. The right answer is option 3 orbital extenteration. The surgical removal of the entire content of the orbit including the eyeballs and eyelids is called orbital extenteration. Orbital enucleation is a surgical procedure where the entire eyeballs including the globe and its content is removed from the eye socket. And orbital evisceration is a surgical procedure involving the removal of the eye's internal content while preserving the outer shell or sclera and attached eye muscles. So some memory tips regarding these terminologies are given in the next page. Let us see that. Ext eyeball eyelid, evis internal enuclei eyeball with globe. So these terms will connect the kind of procedure. Orbital extenteration is the removal of entire content of orbit including eyeball and eyelids. Orbit enucleation is entire eyeball including the globe. So the globe, the eyeball and globe is enucleation. Then orbital evisceration, removal of eye's internal contents while preserving the outer shell. So internal portion is orbital evisceration. Next question. While preparing for insertion of an indwelling urinary catheter for a male patient, the nurse is aware that option 1 the procedure required clean techniques, option 2 the lubricant is not always required, Option 3, smaller catheter used for male patient. And option 4 is the procedure requires surgical asepsis. Let us see the right answer. The right answer is the procedure requires surgical asepsis. This is the elimination method. Here you can see the wrong options because the procedure require clean technique is a wrong option because it is a sterile technique. The lubricant is always required, so that can be eliminated. Then larger catheters are used for male patients. So smaller catheters opposite, so that also can be eliminated. So all the direct wrong option can be eliminated so that the right option, the procedure requires surgical asepsis, can be obtained. Next question. All of the following diseases fall under National Vector-Borne Disease Control Program except filaria, chikungunya, dengue, and plague. Let us see the right answer. The right answer is option 4, plague. Let us see the NVBDCP, National Vector Control Program, specifically focus on diseases transmitted by vectors like mosquito, ticks, and fleas. So vector-borne diseases include in the NVBDCP are malaria, dengue, lymphatic filariasis, Kala Azar, Japanese encephalitis, and chikungunya. So there is a short form for memory tip, KLMC DJ. K for Kala Azar, L is for lymphatic filariasis, then M is for the malaria, C is for the chikungunya, D is for the dengue fever, and J is for Japanese encephalitis. KLMC TJ is a short form to remember for the diseases under NBBDCP. Next question. A patient had abdominal surgery. Now he is in PACU. Which of the following nursing diagnosis takes the priority? Option 1, disturbed sleep pattern. Option 2, acute pain. Option 3, risk for infection. And option 4 is ineffective airway clearance. Let us see the right answer. The right option is option 4, ineffective airway clearance. Here we will see the priorities ABC protocols. So airway is the first priority. Then you can go for pain, infection, and sleep pattern will comes in the next priority only. So airway is the immediate priority in terms of ABC protocol. Next question. Used needles are discarded in option 1, white puncture-proof container. Option 2, red puncture-proof container. Option 3, black puncture-proof container. And option 4 is yellow puncture-proof container. Let us see the right answer. The right answer here is white puncture-proof container. Here you can see the diagram to show the different color coding for the waste disposal. The yellow container is for animal, human, anatomical waste, and red is for the tubings, thick plastic, bottles, syringes without needle, urine bag, gloves, etc. Then the blue is for the broken, discarded, contaminated glasswares, just like ampoules, vials, etc. Then the last one is white for the needle, blades, scalpels, lancet, etc. That is for the sharps. So here in this protocol, the white one is for the sharp containers. Next question. A conscious victim of accident presented with anxious stage, gasping of air, and has a deviated trachea. What diagnosis should the nurse anticipate? Option 1 is pleural effusion, option 2 is tension pneumothorax, option 3 is pneumothorax, and option 4 is hemothorax. Let us see the right answer. The right answer is option 2, tension pneumothorax. Tension pneumothorax is a life-threatening emergency wherein a large air collection in the porous space compromises the respiration and cardiac functions. The signs and symptoms include rapid breathing and heartbeat, contralateral tracheal deviation. This is the most important feature which will distinguish between pneumothorax and tension pneumothorax. Because of the tension developed in the cavity, the trachea can be deviated contralaterally. That is the specific feature of tension pneumothorax. And ipsilateral absence of breath sounds also can be seen. You can see here the collapsed lung due to the tension pneumothorax. Next question. Rat fleas causes which of the following disease? Option 1, Kala Azar. Option 2, plague. Option 3, malaria. And option 4, filariasis. Let us see the right answer. The right answer is option 2, plague. The vector-borne diseases, some of the vectors you can see here. Kala Azar is caused by the sandfly. Plague is caused by the rat flea. And malaria and filariasis are caused by the mosquitoes. Next question. Safe and effective way to destroy the malarial larva. Option 1, use of kerosene. Option 2, using damper fish. Option 3, adding chemicals like bleach to the water. And option 4 is use of spinach. You have to see the word safe and effective. You have to identify what is the real meaning in this question and answer the question. Let us see the right answer. The right answer is using gambos fish. Biological agents like gambos fish are the safest and effective way to control the mosquito population by larval control without affecting the environment. So it is safe to the environment as well. That's why it is called safest method or effective method. The other method mentioned in these options are the chemical methods which can harm the environment. So we cannot consider when the word safe or safest is mentioned in the question. Next question. In order to avoid the injury to sciatica nerve during intramuscular administration, which site is to be avoided? So the sciatic nerve injury during IM injection, we have to consider to avoid which site. Option 1 is ventrogluteal muscle. Option 2 is vastus lateralis. Option 3 is musculus deltoides. And option 4 is dorsogluteal muscle. Let us see the right answer. The right answer is we have to avoid dorsogluteal muscle to avoid the injury to sciatic nerve. To avoid injury to sciatic nerve during intramuscular administration, the dorsogluteal site should be avoided. The sciatic nerve runs through this area, making it prone to injury during injection. A safer alternative is the ventrogluteal site, which is gluteal triangle, which is located deeper and away from the nerve. You can see the diagram here. The cross mark is indicating these areas should be avoided because the sciatic nerve is passing through this area. The greenish area is the safest area for administering IM injections. Next question. The amount of elemental iron in one iron tablet for mother is option 1, 60 mg, option 2, 60 grams, option 3, 50 grams, option 4, 50 mg. Let us see the right answer. The right answer is option 1, 60 mg. Iron tablets for mother during pregnancy typically contain 60 mg of elemental iron. Next question. Which of the following condition is a common cause of fatty diarrhea? Option 1, lactose intolerance. Option 2, celiac disease. Option 3, bacterial and viral infection. And option 4 is sucrose intolerance. Let us see the right answer. The right answer is option 2, celiac disease. Common cause of fatty diarrheas include celiac disease, chronic pancreatitis, cystic fibrosis, bile acid malabsorption syndromes, eating high-fat food, alcohol abuse, giardiasis, and gastric bypass surgery. So here celiac disease is mentioned in the question, which is the right answer. Next question. Contraindication of liver biopsy is option 1, diabetic condition of a patient. Option 2, decreased activated partial thromboplastin clotting time, APTT. And third option is increased activated partial thromboplastin clotting time. And fourth option is immunocompromised patient. This is a tricky question. Let us see the right answer. The right answer is increased activated partial thromboplastin clotting time. These questions should be selected wisely using the elimination method. I will tell you the technique. Here two options like option 2 and option 3 in the box. They are in opposite direction. First option is decrease the activated partial thromboplastin clotting time, and third one is increased activation partial thromboplastin clotting time. So decreased APTT and increased APTT. So one of this should be correct and one should be wrong. So which one we can consider? Because the bleeding, if it is increased APTT type, then chance of bleeding will be high. So that is a contraindication of liver biopsy because it can cause severe bleeding. So option 3 is the right answer. All other options can be eliminated easily. Next question. On auscultation, which finding suggests a right pneumothorax? Option 1, bilateral inspiratory and expiratory tracts. Option 2, absence of breath sounds in the right thorax. Option 3, inspiratory wheeze in the right thorax. And option 4 is bilateral pleural friction rub. Let us see the right answer. The right answer is option 2, absence of breath sounds in the right thorax. Here you can see the option, it is right pneumothorax. So signs and symptoms include rapid breathing and heartbeat is always there for tension pneumothorax because of the pressure developed in the cavity, and here specifically decreased absent breath sounds. During a physical exam, reduced absent breath sound may be heard of the affected side of the chest. Here it is the right side, so decreased or absent breath sounds in the right side of the chest is found in right pneumothorax. Let us see the next question. Which of the following is a non-absorbable suture? Option 1, ethyrod. Option 2, vicryl. Option 3, monofrill. And option 4, chromic catgut. Let us see the right answer. The right answer is option 1, ethylone. Here you can see some examples of absorbable sutures and non-absorbable sutures. Absorbable sutures are vicryl, catgut, monocryl, polydiaxonone, etc. And non-absorbable are ethylene, nylon, polypropylene, etc. Next question. At what time period the child learns about the gender identity? Option 1 is 1 year, option 2 is 3 years, option 3 is 8 years, and option 4 is 10 years. Let us see the right answer. The right answer is option 2, 3 years. Children generally start to develop an understanding of the gender identity between the ages of 2 and 3. By the age 3, most children can identify themselves as either a boy or a girl. After thyroidectomy, carpopedal spasm occur. This is the result of option 1, hypercalcemia, option 2, hypocalcemia, option 3, hypercalcemia. Option 3, hyperkalemia, and option 4 is hypokalemia. Let us see the right answer. The right answer here is option 2, hypocalcemia. After thyroidectomy, carpopedal spasm can occur as a result of hypocalcemia, which is low blood calcium level. See, this hypocalcemia, it is occurring as a consequence of damage to or removal of the parathyroid gland during surgery, because during thyroid surgery we can see the position here. Along with the thyroid gland, the 4 parathyroid glands, you can see it is located on the thyroid. So these parathyroid glands also will be removed during the thyroid surgery. So these parathyroid hormones are responsible for regulating calcium level. So hypocalcemia can happen, which will reflect as a carpopedal spasm. Next question. From following, which is the appropriate method of holding the baby for breastfeeding? Option 1, hold only neck. Option 2, hold baby's lower part. Option 3, hold baby in upright position. Option 4, hold baby giving support to whole body. Let us see the right answer. The right answer is hold baby giving support to the whole body. When breastfeeding, it is crucial to support the baby's entire body to ensure proper latch and comfortable feeding. This includes supporting the head, neck, back, and body with your arms to allow them to position themselves correctly against your breast. See the position here. Next question. In the menstrual cycle, lowering of which hormone causes menstruation? Option 1, progesterone. Option 2, thyroxine. Option 3, estrogen. And option 4, follicle stimulating hormone. Let us see the right answer. The right answer is option 1, progesterone. The lowering of progesterone hormone causes menstruation as it is required for the maintenance of the endometrial lining. So progesterone hormone lowering, which is required for the endometrial lining, the lowering of this will cause the menstruation. Next, bone marrow aspiration in children done in option 1, posterior superior iliac crest. Option 2, proximal tibia. Option 3, sternum. Option 4, ribs. Let us see the right answer. The bone marrow aspiration in children done in posterior superior iliac crest. Bone marrow aspiration in children is typically performed at the posterior superior iliac crest, back of the hip bone, or anterior iliac crest, front of the hip bone. So here, the right option here is posterior superior iliac crest. Next question. Most common cause of infant mortality in India is option 1, low birth weight. Option 2, complications of labor. Option 3, sepsis. And option 4, congenital anomalies. Let us see the right answer. The right answer is low birth weight, LPW. The most common causes of infant mortality in India are prematurity and low birth weight, followed by the pneumonia, birth, asphyxia, trauma, etc. So, infant mortality, the leading cause is prematurity or low birth weight. After this, the conditions like pneumonia, birth asphyxia, trauma, etc. can come. Next question. The nurse has a needle stick injury with a hepatitis B infected needle. What's the priority nursing action? Option 1, wash puncture site with soap and water. Option 2, start PEP treatment immediately. Option 3 is get a doctor appointment. And option 4 is collect needle for laboratory check. Here we have to see the order of protocol of priorities. The right answer is wash puncture site with soap and water. Here, priorities, we have to do it step by step. So, first priority is to wash the puncture site with soap and water. And then it will come for immediate attention to start PEP treatment. Then the blood investigation of the affected patient or the patient who has been on investigation can be done. So, all the protocol according to needle prick injury protocol we can follow, but the immediate first aid is to wash the puncture site with soap and water. So this is the right answer. Next question. Failure to pass meconium within the first 24 hours after birth may indicate option 1, abdominal wall defect. Option 2, celiac disease. Option 3, pus sponge disease. And option 4 is intussusception. Let us see the right answer. The right answer is option 3, pus sponge disease. Failure to pass meconium within the first 24 hours after birth can indicate an intestinal obstruction which may be caused by conditions like Hirschsprung's disease or meconium plaque syndrome. Hirschsprung disease is a congenital disorder where nerve cells are missing from parts of the large intestine, causing difficulty in moving the stool. Next question. Choose the correct statement for trochosis. Option 1, tremor, rigidity, bradykinesia, and hypokinesia. Option 2, ischemia induces carpal spasm by inflating the blood pressure cuff. Option 3, twitching of patient muscles when the facial nerve is tapped. Option 4, sudden and severe attack of pain, swelling, redness, and tenderness in the joints. Let us see the right answer. The right answer is Ischemia induces carpal spasm by inflating the blood pressure cuff. Trousers side is a carpospedal spasm or muscle contraction in the hand and wrist induced by inflating a blood pressure cuff on the arm to a pressure above systolic blood pressure of for a few minutes. You can see the figure. So this is trousers side. The facial deviation is chopstick side. That is also given the question. So the right option is given here. Ischemia induced carpal spasm by inflating the fresh cup, that is tricep side. Twitching of facial muscle is chopstick side. So we are winding up this session. Thank you all for watching this video. Please like, share and subscribe for more videos in this series. Thank you so much.